Good afternoon, everyone. Thank you so much for joining us on this webinar for responsible drinking while we're all sheltering in place. We're going to start by talking just a little bit about us and our practice, and then Medea is going to jump in with some information about alcohol and how to use it responsibly. And then Zoe's going to jump in with a moderation plan for those of you who are interested in reducing your drinking. And then at the end, I'll cover some resources that you might find helpful for changing your relationship with alcohol. So Zoe, Medea, and myself work in a private practice in San Francisco where we specialize in treating addiction. And we do so from a harm reduction perspective. And for those of you who may not be familiar with harm reduction, it's a pragmatic and compassionate approach to addiction treatment that makes room for substance use goals outside of abstinence. So it's a really great option for folks who don't think they want to abstain or are not sure about abstaining, want to maintain a relationship with drugs or alcohol, and where they can learn how to do so in responsible ways. And we also work with the issues that are underlying the addiction. So if the person is presenting with something like anxiety or depression or an underlying trauma disorder, we work with those things concurrently with the addiction. And if you want to learn more about us, you can do so at our website. It's jenniferfernandezphd.com. So we decided to put together this webinar because we learned that folks were drinking a lot more during shelter in place. As you can see here, in just in a 6-week period, sales for liquor went up by 33% compared to the year prior. And it's just something that we had been observing in our communities as well, that because we are being socially isolated, we're increasing our coping behaviors. And some of those coping mechanisms may be healthy. So some of us may be exercising more, reading more, cooking more at home. But I think all of us are also coping in ways that may not be so great for us, because this is a really unprecedented thing in our lifetimes. There's really a collective trauma in being isolated from each other and having to shelter in place. So it makes sense that as humans, we're just kind of grabbing at whatever straws we have available to us to be able to move through this. So we want to be able to help you create a plan so that if you are drinking too much, you can start reducing that behavior. And we also want to share some ways for you to get support during this time, since you may not have your usual tools or support systems available to you. So now I'm going to turn it over to Medea, who's going to talk to us a little bit about how to measure alcohol, and we'll share some guidelines with us about how much is safe to drink.
Hi there. So some things to keep in mind when measuring alcohol and thinking about responsible drinking. Some tips for you are, for hard alcohol, you can purchase a jigger, which is what they use to make mixed drinks at bars. One side they put the mixer, and the other side they'll put the hard liquor. And so the larger side, a standard jigger is 1.5 ounces, which you can see here on the graphic says is a standard drink measurement. And on the other side is 0.75 ounces. Something to keep in mind here, though, is that they do also sell jiggers of different sizes, and they're often bigger than the standard size. They'll sell some that come with one side with 2-ounce measurements and on the other side with a 1-ounce measurement. So this is something to be aware of when purchasing one. For wine, a helpful tip for folks is to be able to use a measuring cup to measure what 5 fluid ounces looks like in a glass of wine. So for 5 ounces, you can use half a cup and 2 tablespoons. Once again, that's half a cup and 2 tablespoons equals 5 ounces. And something to think about here is that red wine often has a higher alcohol by volume amount, that's sometimes referred to as the ABV of an alcohol, than white wine. So when you're measuring, to keep that in mind. For malt liquor, you can also use a measuring cup to measure out amounts to keep yourself within the recommended amount. So for 8 ounces of malt liquor, that equals about 1 cup. and for 9 ounces, that equals about a cup and 2 tablespoons. Um, Something to think about here is, malt liquor. A lot of people understand it as drinks like Colt 45, which are a little bit more old-fashioned ways of drinking malt liquor. But malt liquor is actually very popular right now. You see it all the time in pop culture in the form of hard seltzers. So things like White Claw and Truly, you might recognize some of those names. And an important thing to note here is that most cans of hard seltzer come in 12-ounce cans. And when you look at this graphic here, you see that a serving size is 8 to 9 ounces. And so a full can of these hard seltzers is way over a single serving size. So it's helpful to be able to measure out a single serving size and save the rest for later or get rid of it. Something else to keep in mind here when thinking about the malt liquors is that the alcohol by volume here is 7%, which is close to a lot of IPAs as well. So when you look over on this graphic, you see that a lot of beer is 5% alcohol, while IPAs can be closer to 7% and sometimes even higher. So to keep that in mind when measuring out the beer that you might be drinking. So here we have a graphic that shows more or less how many standard drinks are in each of these vessels. And so for glasses of wine, this can be a tricky one because trendy glasses of wine now are often really wide and deep. And so the concept that I know a lot of people use to measure wine is saying, oh, more or less half of a glass is a standard drink, when in reality, you can see on this graphic here that about half of a glass of wine is closer to 1.4 or 1.5 standard drinks, 1.5 being for red. And you look here at this bottle of wine, it states that 6 to 8 standard drinks exist in a bottle of wine, whereas I know a lot of people are under the misapprehension that it's closer to 4 drinks. So, when we're thinking about 6 to 8 standard drinks, we're going back to that idea of 5-ounce pours. So here in the box of wine, it's 18 to 21 standard drinks. If we go down here to the beer section, the full strength beer, we're looking at a 285 milliliter glass on the left. And then on the right, it's a 425 milliliter glass, which these types of glasses for beer are often found at beer gardens. And so when you're at a beer garden and you're drinking beer in a cup this big, you're really drinking more of 1.6 standard drinks instead of 1. So you can just kind of go along this graphic and see oftentimes in a can of beer, it's closer to 1.4 standard drinks. In a case, it's 34. You come down here to the bottom row, high strength spirits, 1 standard drink. You look over ready to drink spirits, 1.5 standard drinks per can. That's kind of coming back to that idea around the White Claw as well. And for high strength spirits, there's 22 standard drinks and 1 700 milliliter spirit bottle. So here we have a slide on the daily intake recommendations as designated by sex. And so we have here at the top male, or people who were assigned male at birth, and on the right the column for female and people who were assigned female at birth. Now, the daily intake recommendation varies here by sex due to the hormone variation. And that determines how people are able to metabolize alcohol. It varies depending on the hormonal balance in each person. So things to look at here. For a single day, daily intake recommendations for men or people assigned male at birth, it's no more than 2 drinks. And for women, it's no more than 1 drink a day. Per week, it's no more than 15 drinks for men and no more than 8 drinks for women. Now that, if you remember from the slide before, means for a bottle of wine, that's 8 drinks. That means for women, the daily intake recommendation, or in this case, the weekly intake recommendation, would be only 1 bottle of wine per week. Now, it's also important to remember that the CDC recommends that over the week for both male and female folks, that there should be at least 2 days without any alcohol at all. So here we have a slide on binge drinking and a way to help us understand what binge drinking looks like. So in order to qualify for binge drinking, the number of drinks listed below, so that would be 4 for women and 5 for men, needs to be consumed in a 2-hour period to be considered binge drinking. However, that does not mean that drinking more than that amount or that amount in over a 2-hour period is not potentially harmful or dangerous drinking as well. Something to consider here is that binge drinking is often associated with higher risk behavior and behavior that is often misaligned with people's values. Another thing we want to consider is blood alcohol content, which is not listed here in this graphic. So blood alcohol content over 0.08% is considered legally intoxicated. That being said, if you're drinking 4 drinks or 5 drinks in over a 2-hour period, but you still have a blood alcohol content over 0.08%, you're still considered in the legally intoxicated category, even if you are technically not binge drinking. Now, I know this slide has a lot on it, but let's just take it in smaller pieces, right? So this is a slide of information for potential long-term effects of alcohol use. Now, on the left-hand side in the red category, you'll see this is for large consumption. And so for women, that's anything over 8 drinks. And for men, that's anything over 15. Back to those slides that we were talking about before. And on the right-hand side, it's long-term effects of moderate to light drinking. And there are still long-term effects for that as well. Some of the things that we can see here are impaired brain development, anemia, cancer, Wernicke syndrome. And then there's some psychological effects as well, too, that you see over here on the large consumption side. You know, depression, anxiety, panic, psychosis, right? Delusions. These are things that can happen with long-term drinking. There are also psychological effects that are associated with shorter-term drinking, but still large amounts of drinking. Anxiety, depression can come up with that too. Memory loss or trouble recalling things, reduced inhibitions, right? These are shorter term effects of drinking as well. When we think about these longer term effects like cancer, if you already have a family history of cancer, this is only going to increase the possibility as well. So that's something that we like folks to consider, right? Some of these long term effects that we might already have predispositions for. So how do we know when we're drinking too much? How do we know how much is too much? We've looked at all of the volumes, right? All of the ways in which we can measure. And maybe if we're going against the CDC guidelines, we already know that we're drinking more than they say. But what about the emotional piece behind it, right? And the social piece behind it? How do we know how much is too much? Something that can come up for a lot of people is the feeling of shame. You wake up the next morning and you have this self-critical voice, feeling embarrassed about how much you drank, not wanting to admit to yourself or to other people the amount that you drank last night, the amount that you've been continuing to drink. You're noticing that then drinking is not aligned with your values, right? Or that the types of behaviors that you're participating in while you're drinking are not aligned with your values. Those are some of the things that you can start to notice to determine if your drinking is too much. Then we have feedback, right? Feedback from people in our lives, from our family and friends, maybe our roommates making comments about how they think we might be drinking too much, that they're worried about our behavior. Maybe you start to notice that folks are asking you if you're okay more or how you're coping with the shelter in place. People at work might be noticing things. Perhaps your drinking is starting to impact your ability to work. You notice that you're starting to work later and later throughout the day. You're not able to focus very well. You're struggling with hangovers throughout the day, things like that. And then we can talk about the physical consequences. Disrupted sleep, struggles sleeping throughout the night, staying asleep. Then the next day or throughout the day after, lack of energy, lack of motivation, really struggling to get work done, to take care of basic self-care feels hard. Hangovers and hangxiety. People have been throwing around this term hangxiety, and the way in which we like to explain it to folks is that alcohol targets the GABA receptor in our brain, which makes you feel relaxed and cheerful when you're drinking. But when you drink too much and then stop, you end up with an unnaturally low amount of GABA function in your brain, which can result in spiked anxiety. And so your brain is not able to compensate for the amount of GABA receptors touched while you're drinking. And so you wake up the next day not only with a hangover, the headache, and all of the symptoms that folks get associated with that, but a really increased level of anxiety.
Okay, Medea, thank you so much for giving us that information on the biological and psychological aspects of drinking, some of the risks to be aware of. And now maybe we can talk a little bit about some of the benefits that you experience in your relationship with alcohol. So we want to look at this not just as a biological phenomenon, something that's happening in your brain or in your body, but really related to attachment and relationships and the bond that you form with anything that brings you comfort or pleasure or relief. So an exercise that I like to do with folks is to get them to think about alcohol as a type of partner. So if this were a boyfriend, a girlfriend, a close friend, whatever that may be, how would you describe this relationship? How would you describe this person, right? How and when is this person there for you? When do they show up? And are there any similarities to other relational patterns that you notice currently or from the past? So this is something that you could journal about as you're trying to evaluate whether you want to make a change with alcohol or to help you evaluate what type of change you would want to make. So something to really think about is how you feel before you drink, while you're drinking. Maybe, you know, during that first drink, you'll be able to have a little bit more insight into it. Subsequent drinks, you may start losing some inhibition and some focus. So that journal exercise is better done during that first drink. And then how do you feel afterwards? And again, your feelings are going to give you important clues about the changes that you may or may not want to make. So in the bottom here, there are some other things to consider when you're evaluating your relationship with substances. One is attachment style. I won't go too much into that, but there's like a whole literature on attachment and how we as humans form relationship, which you can dive into if you're interested. I just want to talk about the basic idea of secure versus insecure attachment. So when I'm in a secure relationship, I don't feel shame, right? That doesn't mean there's no conflict or difficulty in the relationship, but I don't feel less than in that relationship. And that relationship generally is fun. Again, there may be growth that has to happen in that relationship, and that's important. But it's not one where I feel small or scared or out of control. Right. And so insecure attachments can have some more of those feelings. I may feel less than the other person, or I may feel more than that other person, right? I may feel better than the other in an insecure attachment. So something to think about. You know, there probably was a time in your relationship with alcohol where you didn't feel any shame and you did have fun. And that's why we do drugs, right? This is why humans alter their consciousness, because it's fun, because it's interesting, and there's no shame in that. So maybe be curious if you're noticing that the relationship with alcohol is turning a little bit more insecure and you're having more problems with it. When exactly did that happen? Can you remember when that started to shift? That's another great journal exercise that you can do. And then the other thing to think about is, what would it take for that relationship to become secure again? For folks who, in my experience working with clients, for folks who have recently had a problematic relationship with alcohol, and it's only been going on for maybe a year or less, they do have some success in reestablishing a secure relationship with it, where they're able to moderate, they feel like they have control over it, and it doesn't cause as many problems as it used to. For folks who have a much longer relationship, a longer problematic relationship, I should say, with alcohol, that can be more challenging. You may not be able to achieve that same, kind of laissez-faire, have fun, moderate relationship. And so if that's the case, if you think that that may be the case for you, then something to think about is grieving and ending that relationship. If abstinence is something that you think is the right choice for you, just being mindful that that's a huge loss. Again, this is a bond that you have formed, that you counted on for whatever it was, relief, for escape, for, maybe feeling a little bit better about yourself to show up in social situations. Um, so the other thing I want to talk about is needs. And really, this is the most important piece of your relationship with alcohol to understand, because it's going to inform the most compelling alternatives for you. So like I said, we all use substances for a reason. If we can get in touch with what needs are being fulfilled, as I mentioned, relief, release, confidence, those are important needs that need to be met. So you have to find other ways for those needs to be met. You can't just negate those needs. Otherwise, you're just going to relapse and go back to using alcohol problematically, or you may start using other behaviors or substances problematically. And so it's really important to understand what it is that you are medicating, or how exactly it is that you're taking care of yourself with this relationship with alcohol. And then the last piece is values. So thinking about the values that I honor when I am engaging with this substance, and the values that I may be violating, the way that it may get in the way of being my best self, the best person I can be. And again, this is going to help you with motivation. So if you're choosing behaviors that are based in your values, that's going to help you move forward, as opposed to feeling that you're choosing behaviors that maybe don't really fit with a sense of who you are. So for me, that's like exercise. I really hate exercising. So a more values-based intervention for me would be something like dancing, or playing some kind of physical game, playing a game of softball or something like that is a good way to keep me active, as opposed to going to a gym and lifting weights. There's not a lot of value in that behavior for me, but there's a lot of value for me in dancing and in playing in teams. So an example for how you might think about some of the alternatives for drinking, if you're curious about having your needs met in a different manner. Okay, we're going to turn it over to Zoe now, and she's going to talk to us about how to create a moderation plan.
Hi there. I'm going to go over a few strategies to help you be a little bit more mindful and intentional about your drinking. The first we have here is start and stop times. So you can pick specific times to start and stop drinking, so that you can really maximize the benefits and minimize any unwanted drawbacks of drinking. It can be helpful to keep a journal or a diary to track your drinking. You can have that way you can really get like a realistic view of your consumption over time. You can then kind of use this data to identify and set personal goals around your drinking. We have kind of some outlines, some apps here that make this easier. So the following: the Drink Aware, IntelliDrink, Drink Control. These apps not only allow you to track how many drinks you consume, but can also tell you your caloric intake and even how much money you're spending on drinks at a given time, which can be helpful. A simple but important tip is eating. So you don't want to drink on an empty stomach. Eating high protein foods, so eggs, chicken, cottage cheese, before and while you're drinking will slow alcohol absorption and moderate your blood alcohol concentration. Hunger, like thirst, can also tend to make you drink more than you'd like to. Go slowly. So to aid in this, you might want to first start with a non-alcoholic drink to quench your thirst, and then try to maybe alternate between alcoholic and non-alcoholic drinks to avoid consuming too much too quickly. A good rule of thumb might be to try to stick to consuming 1 drink per hour. And then purchasing small amounts. So I know we're all kind of at this time trying to stock up on items to limit the frequency of going to stores. But if possible, try not to purchase large amounts of alcohol. You may consider buying your typical amount or even less. like a half bottle of wine, a 6-pack of beer instead of a 12-pack. This will reduce the temptation to drink more than you initially intended, just because it's there in your kitchen and you have access to it. In addition to purchasing smaller amounts of alcohol, consuming drinks with less alcohol is also a good idea. So you can reduce the percent of alcohol by volume by adding club soda or sparkling water to wine, and selecting beers with little to no alcohol in them, which as a bonus often tend to have fewer calories and fewer carbohydrates. You can also increase the amount of mixer in your cocktails, which will reduce the ABV. Next is planning sober days. So incorporating sober days into your plan could help you avoid any unintentional increase in the amount you drink. It's recommended too that these days be the same days every week, so you can build up and grow accustomed to a routine that you're going to be more likely to follow through with. Following through with your plan may also be easier if you have someone who knows what your goals are for drinking. So a sober buddy or an accountability buddy who you can reach out to when you're feeling the urge to break away from your plan. This person can really help you remind you of why you started the plan in the first place and help you make kind of the safe and responsible decisions when it comes to drinking. A major part of being mindful about your alcohol use is identifying when drinking may be more harmful than helpful to you and implementing boundaries or limits. For instance, when you're feeling sad, anxious, or stressed, drinking in these situations may seem like a good idea, but often it can serve to exacerbate these feelings and could lead to you doing or saying something you might regret later. So to aid maybe in developing firmer boundaries, it might be helpful to develop a list of what you like and dislike about your drinking. And then keep this list close, right? So that you can refer to it when you feel the urge to drink. This will help you better identify why you want to drink and support you in making an informed decision about whether or not to start drinking at that time. So when you are considering reducing your alcohol consumption and developing a specific plan for moderation, you can use the strategies outlined above. So again, that planning specific days for drinking, planning specific days for taking off from drinking, choosing those start and stop times, selecting kind of the amount you want to drink and the type of alcohol. But remember to do this really all beforehand. And so you might want to plan out what a week is going to look like for you using these tips. Another helpful technique when trying to cut back on or eliminate your alcohol use is urge surfing. The idea here is that urges are very similar to a short but exhilarating ride on a wave. When we don't try to talk ourselves out of urges or distract ourselves from them, they tend to just dissipate within minutes on their own. Therefore, the trick is really to surf the urge, which means simply acknowledge it, notice how and where you feel it in your body, breathe with it. You can start to ask yourself, does the intensity change with the cycle of the breath? Noticing the physical sensations of urges with kind of this openness, curiosity, interest, really is facing it head on without feeding it or fighting it. And this tends to allow the urge to pass on its own. Alcohol withdrawal symptoms are also incredibly important to remember. If you've been regularly drinking pretty heavily, which as we previously mentioned, is considered to be more than 8 drinks a week for women and more than 15 drinks a week for men, it's important to never stop drinking cold turkey. Alcohol withdrawal symptoms can vary based on a few factors, but the most severe, which are seizures, can be fatal. And there's a slide, the next slide, with that graphic. And as you can see, these seizures tend to happen within the first 2 days of stopping drinking. So this is really why it's important, especially if you think you are in this heavy drinking group, to reach out to a professional for help when you're considering reducing your alcohol use or abstaining altogether. Dr. Fernandez is going to talk a little bit more about withdrawal symptoms a little later. So Moving ahead. So you might also expand that list that I mentioned about likes and dislikes about drinking to include the benefits and costs of making a change and not making a change in your alcohol use. This is called a decisional balance, and can help you explore all the potential thoughts and feelings, including any ambivalence that you have when it comes to making a change in your drinking behaviors. A decisional balance really gives you kind of a better idea of the pros and cons of changing your relationship with alcohol and can give you a better understanding of the role that drinking plays in your life. You can kind of begin to explore questions such as, what do I gain out of or get out of using this substance? What need am I fulfilling with alcohol? How does drinking interact with my value system? There's also a weighted decisional balance on the next slide here, which is slightly different because it allows you also to rate the importance of the items in each column. So you can see their ratings from not important to very important. By determining your most important gains and losses, it becomes a lot easier to identify the values associated with your drinking behaviors, which will increase your motivation to change and lead to more lasting change. So this can be really helpful for folks. So from here, you can develop a list of alternative activities and strategies to meet the needs and values previously met by alcohol. For instance, if drinking alcohol really helps you reduce anxiety and relax, like it does for a lot of folks, then it would be helpful to brainstorm a list of other ways you can reduce anxiety and relax, such as exercise, watch a favorite TV show, talk with a friend. This list can really help remind you that there are other ways to meet your needs and make it easier to reduce your alcohol use. So now I'm just going to throw it back to Dr. Fernandez. I'm just going to talk a little bit more about how to recognize when you might need professional support around moderating your drinking.
Thanks, Zoe. So yeah, now I just want to go over the criteria that we use as healthcare professionals to alert someone about the potential long-term risks of alcohol use. So if you've experienced any or two of these in the last 12 months and they have led to significant impairment in your functioning or significant feeling of distress, then that's when you know that it's time to reach out to somebody. So if you notice that you're drinking more or that you're drinking over a longer period of time, if you've tried many times to cut down but you're unable to, if you notice that you're spending more time just thinking about it, trying to obtain alcohol, the urges that Zoe mentioned. So this is different from a craving. So a craving is like, I would really like Manhattan right now. And an urge is this physiological sense in your body. A lot of folks experience it as a tension in their stomach or a tightness in their chest. So it's really hard to distract oneself from an urge, which is why urge surfing can be so helpful, or any other kind of mindfulness technique that you know works for you, focusing on your breath or using imagery to help de-escalate that agitation in your body. But if you notice that you have a lot of those when you're not drinking, that may be a sign that it's time to reach out for help. Of course, if it's getting in the way of any of your responsibilities, obligations, or relationships, if you notice that you're putting yourself in physical danger or putting others in physical danger with your drinking, and if it's causing recurrent physical or psychological problems. So again, if you notice 2 or more of these in the last year, that would be an indication to you to reach out for support. So I want to talk a little bit about tolerance and withdrawal, which are also part of the picture that we look at as clinicians. So tolerance is needing to consume more of the substance in order to have the same effect. So when you first started drinking, whether that was in high school or in college, maybe earlier for you, you may have gotten buzzed just by having 1 or 2 beers. And now as you're later into your adult life, you may notice that you need a bottle of wine or half a bottle of liquor or whatever it is that it may need for you to start feeling buzzed. So that's an indication of tolerance. Your dopamine receptors have become accustomed to that flood of GABA and that flood of dopamine associated with alcohol. and your brain wants more, craves more of that dopamine release in order to have the same effect. And then withdrawal, which Zoe mentioned, can be fatal with alcohol cessation. I think that's something that folks aren't really aware of, don't really think about. I think in the media, some of the other drug withdrawals have been portrayed as deadly, or at least very uncomfortable. But it's important to know that withdrawal from alcohol or any other GABA agonist, so like benzodiazepines, Xanax, that kind of stuff, never, ever, ever stop those kinds of substances cold turkey, namely because of the seizures that we mentioned that can happen very quickly. The onset of those is very, very fast, and very serious. Some other things you may notice if you're cutting down, sweating or racing heart rate. You may have the shakes, right? DTs. Definitely some difficulty with sleeping as your sympathetic nervous system, the on switch, the fight or flight system in your body is going to be activated. In some cases where folks drink very, very heavily, withdrawal could lead to hallucinations or delusions. There's going to be physical agitation and anxiety, as we noticed, or as we discussed earlier, which Medea mentioned. So again, withdrawal is going to happen for someone who is physically dependent on alcohol, so drinking large amounts over a long period of time. Okay, well, that is it from us. We wanted to share a little bit about a group that we are going to be starting that Medea is facilitating. So anyone who lives in California can join our online harm reduction group. You can learn more by reaching out to her directly at the email below or reading more about it on our website. Medea, do you want to talk a little bit about the group?
Sure, yeah. So as Dr. Fernandez said, it's a harm reduction group. And what we're going to do is we're going to be going through her workbook. It's based on her workbook called Power Over Addiction. And it's a harm reduction workbook for changing your relationship to alcohol and drugs. And so at this point, we're in the waiting list phase. And once we get the waiting list up a bit in numbers, we're going to start the group, and we'll be doing that virtually through VC, likely perhaps Zoom, until the shelter in place is over. And depending on the reach, and if folks are local or not to the Bay Area, we'll consider keeping it online as well. But yeah, that's about it for now.
Thanks, Medea. And then lastly, we just want to share some resources with you. So some books. There's my workbook, Power Over Addiction. Responsible Drinking by Frederick Rogers is excellent, and a lot of the tips that we talked about. So a very pragmatic approach to reduce your drinking. How to Change Your Drinking is also a wonderful resource by Kenneth Anderson, who runs the HAMS network, Harm Reduction for Alcohol. They have a great and very supportive group on Facebook if you want to look them up, HAMS, H-A-M-S. And then Over the Influence by Pat Denning and Jeannie Little, which has tons of information about all the different kinds of substances and how to help you have a healthy relationship with them. And then also some meetings, some support groups that you might find helpful. I didn't list AA because I feel like everybody knows about AA, and I wanted to put the spotlight on some other groups that you might find helpful. All of these groups, except for moderation management, do help folks work towards abstinence. But I think that especially Smart Recovery and Refuge Recovery have lots of helpful techniques and interventions, even if you don't want to abstain. So Smart Recovery uses cognitive behavioral therapy to help folks change their relationship. And then Refuge Recovery is based in Buddhist philosophy. So they bring out a lot of Dharma talks and mindfulness into evaluating your relationship. Moderation management is specifically for folks who don't want to abstain and for those who want to reduce their drinking. And then apps, I really like Drink Coach and Sing When, because they also incorporate some assessment. So if you're not clear about whether or not your drinking is in that degree of problematic, if you're maybe like on the cusp and you're not totally sure, you can take some quick confidential assessments on Saying When, And then also, I really like that they have built-in notifications to keep you motivated and help you track your drinking. I think they both also have indicators for how much money you're spending. Do be warned that they are, I think Drink Coach is based in the UK and Saying When is based in Canada. So they do have slightly different regulations around what a standard drink is. So be mindful of that if you're going to use those apps. We have tons more resources on the website if you want to check that out. Lots of books and some helpful blogs about how to be in healthy relationship with substances. So please reach out to us if you have any questions. Our email address is down here below at hi@powerofaddiction.com. I started a recording a little bit late, unfortunately, so we may have to go back and record the beginning of the meeting. But we will have that recording available and host it on the website, so you can share it with others who weren't able to make it today. But thank you so much for spending the afternoon with us. And again, if there are any questions that you want us to answer now, you can send us a chat. We'll be here for a few more minutes. Thanks so much, everyone. Stay safe and stay healthy out there.